There's a new analysis out examining how much various diseases and ailments are costing you, the American public. Topping the list of total expenditures is diabetes. Take a look at this. U.S. spending on diabetes now topping $100 billion. The disease becoming so widespread it is now weighing more on healthcare costs than heart disease, back and neck pain, high blood pressure. The cost of diabetes affecting all Americans' healthcare spending, whether they have the condition or not. So, wow, got to wake up to that. Let's bring in Dr. Nina Ratcliffe, who is a private practice physician and an anesthesiologist. Great to see you. Happy New Year.
Great to see you.
Why the skyrocketing increase in diabetes diagnosis as well as treatment?
Well, first of all, every year healthcare costs do increase, but over the last few years, more people have gotten health insurance with the Affordable Care Act, and there are new medications being introduced that are just high in price.
Right. But diabetes, it has risen twice as fast as all the other ailments combined.
Right. And that's what's very interesting. It is the 7th leading cause of death amongst Americans, and it exceeds the cost that we pay for heart disease, which is the leading killer amongst American men and women. So what's interesting is that half of all American adults are affected by diabetes. Half. 29 million have diabetes, about 79 million have pre-diabetes. So we are going to see these numbers increase, and it is growing 6% every year.
Well, is it because increasingly Americans' waistlines are expanding, and, you know, obesity is related to several kinds of diabetes, type 2 diabetes?
Absolutely. Maintaining a healthy weight is one of the most important things we can do. Fat cells affect the way the glucose is managed in our body, and diabetes is a metabolic disease. And if you sit there and you burn that fat, you're decreasing your risk for diabetes. All
right, I want to read this. There's a new NIH study. Exercising is the top way to shed extra weight, but it's low among overweight people because of a chemical imbalance in the brain.
Right, and that study was done on mice, so animals. And so while that may be true in people and humans, what we have to realize, these are the people who need to do it more and be more committed to it. So yes, we cannot say that we have a handicap on our shoulder, that we cannot exercise because we are overweight. There are other things we can do, which is eating healthy and consuming proper amounts of food.
All right, the other thing that caught my attention, we're spending almost $90 billion a year on low back and neck pain, and it is especially acute among working-age people under 65. That 70% of them are suffering from this chronic back and neck pain.
Right, and there's two very important points. First of all, sometimes it may be rest, physical therapy, and non-surgical interventions, but many times we jump to having surgery right away. So we need to look at this, and this is why studies like this are important. It helps us focus, allocate and reallocate funding to make sure we are getting the most effective value for our dollar.
Right.
And I want to point out another thing is that opioids. We have an opioid painkiller epidemic in this country.
Do.
And I'm not sure how much was covered in this, but that is the #3 cost of healthcare dollars. Are we really even considering the cost of opioids in that?
You know, the other thing I read here is prices for existing brand name drugs grew by double digits. And that's the 4th year it's done that. Right.
And as we get more technology, costs increase. But we also have to look at the fact, for example, diabetes. 60% of the cost is for medications. But are these medications decreasing hospital visits? Are they decreasing the amount of surgery?
So they might be doing good.
Improving quality of life.
But look, people increasingly can't afford their meds.
Correct.
Do we need a concerted effort for more generic brands that are less costly?
Yeah, we do, and that's what these types of studies do. They help us look at this picture in totality. And I do want to point out that, you know, for people watching, these numbers sound astronomical. We're talking about billions, if not trillions of dollars, and they cost us a lot personally. And as we're welcoming the new year's, 2017, our resolutions, I want to encourage people to make their health the #1 priority.
You know, we said diabetes is at the top. I don't want to misrepresent what's going on here, because cancer should be, it's $115 billion a year that's spent, but the study divides it up into the different categories of cancer. So, but if you add them all up, cancer would be tops.
Absolutely.
All right.
Bring up a good point.
Dr. Nina Ratcliffe, always great to see you. Happy New Year.
Thank you. Happy New Year's.